Good day, my friends. This is episode number 14 from On Call with Doc Dave. Today we're going to talk about a very serious and common medical entity, and it's called mental health. Now, this is a very intense and somewhat confusing and very in-depth discussion, which we can't go into in a relatively limited period of time. But what I plan to do today is to break down the generalities of mental health. In other words, how they affect people, how they are treated, how the different types of specific mental health disorders, just so that you get a feel about mental health more than just things you hear on the news or maybe read superficially. So, mental health generally starts in the mid-teens to early 20s. What is the definition of mental health? Well, it's our emotional, psychological, and social well-being. Things that cause mental health, how do you get mental health? It's partially genetic and partially environmental. Now, the environmental could be from childhood abuse, traumas in your life, or neglect with a noted chemical imbalance. So that's kind of the generalities of what cause mental health. The four types of mental health issues that are the most common categories are, number one, mood disorders, such as depression or bipolar. Number two would be antisocial disorders, such as manic depression, antisocial psychosis, things that are against general society's interpretation of how people should act. Anxiety disorders such as panic attacks, personality disorders, again, those fall into your antisocial disorders, and your psychotic disorders, which are the most difficult and most prevalent that you see in people that are generally in the homeless population. They're the schizophrenia, and they're the people that are unpredictable and very difficult to live with. Now, the most common deaths from mental health disorders is anorexia. It kills the most mental health inflicted personalities. And it is a restrictive mental health. And, I don't want to go into too much detail in these, but it's just something you need to know. Now, stage 4 mental disorders are the most severe. These are the ones that lead to suicide or homicide, either suicidal or homicidal in patients. And we'll go through those in a little more detail later on. So, how does mental health affect daily activities? Now that we kind of know what causes mental health, we know the different types of mental health, we know what age they come on, we understand the definition of mental health. How does that affect your daily activities? Well, people are generally very sad and tearful and depressed. They have a feeling of helplessness or overall exhaustion, so it limits their physical abilities. They have unbearable stress, which can lead to anxiety and dysfunction. And they have a negative outlook on life, which is, again, depression, which can lead to suicidal ideation. So, in generalities, how do you manage mental health issues? What can people do for themselves? And then we'll get into medications and psychiatric interventions. Well, here's a few things people can do for themselves. Regular exercise. Walking 30 minutes a day clears your mind, as they say, and keeps you grounded and keeps stability in your life. eat healthy, regular meals and keep well hydrated. So, you are what you eat is what they say. But, in mental health issues, it really makes a difference. You're just eating fast foods all day or drinking alcohol or whatever. You're not going to have a good outlook on life. If if you take the time to take care of yourself and your body and you make some good meals, you're going to feel better about yourself. A real big one is sleep priority. You should be getting at least 7 to 8 hours of sleep a night. Being sleep deprived can cause, trouble making decisions, clear decisions, solving problems that come up on your daily activities, being very frustrated with little issues that shouldn't cause so much frustration, and being short-tempered and basically emotional fragility. So sleep is extremely important. Doing relaxation activities like reading, going to movies, communicating with people, those type of things keep you grounded and keep you focused. Set reasonable goals and priorities. Don't overset your goals because then you don't reach them and you get depressed because you didn't reach them. Same with priorities. Set things in a moderate range that you need to attend. And, and then you'll feel good about yourself because you've overcome those goals and priorities that are important to you in your life. Focus on the positive events in your life. Family, grandkids, friends. Don't be negative. Don't let the negative feelings overcome and overpower the positive aspects in your life. So what are the most common mental health issues? Well, dementia is very, very common nowadays. They say 7% of the population will have exposure to dementia. Depression and anxiety, those are very high on the list. So, and then there's a word that a lot of people hear in different occupations. I know in medicine, when I went through all my years in medicine, that you always hear burnout. What is burnout? Well, burnout is generally a complete mental, physical, and emotional exhaustion. And you just need to get out of whatever is causing that. You need to either take a prolonged break, like in medicine and some of the companies I worked for, after a few years of working, they would give you like a 6-month sabbatical so you could just get away and reboot and focus your brain and come back and be a better physician. So, or maybe pick another field. Maybe the field occupation you chose is something either you're not qualified for or you just decide it wasn't the right decision to make when you made it. And here's an interesting one. Murders. People who murder people. Their primary mental disorder is schizophrenia. Secondary is bipolar. And third, very close, is a major depression. So those are just little tidbits that you may, enjoy knowing about. So medications. Okay, so let's go to the treatment of mental disorders. Now that we kind of understand it a lot better, how do you treat it? Well, first thing is you got to get psychiatric intervention. You have to go get a trained professional psychiatrist involved because that's where you're going to develop your bridge with a person who is going to be able to understand your medical disorder, have some compassion for you, and explain how he's going to treat it and how you're going to respond to it and how you're going to improve. And you have to have somebody on the outside looking in. And that outside psychiatrist is a physician. You go to medical school and you take psychiatry as your major instead of surgery or emergency medicine or orthopedics. And they are very well trained and they are professionals, and it's their job to help you, not your job to entertain them. So get yourself somebody that that you have good chemistry with, that you feel an attachment with, that you think cares about your problem. And this will be something that you need to do on a prolonged basis. This isn't just like going to physical therapy for 3 months and then your muscles are all better. This is something you're going to need to do for years and years. And in the long run, it'll be so beneficial to you. So that's the number one thing. Number two thing is also involved with the psychiatrist is they will prescribe medications for you. So what, in general, I don't want to get too detailed here, but in general, what medications are used in mental health? Well, there's something called an SSRI, which is a selective serotonin receptor inhibitor. And this increases the serotonin in your brain, which is a goodwill hormone. Makes you feel better, makes you feel upbeat, and it's just something that some people have don't have the correct serotonin production in their body, and so therefore it gets depleted too easy. So this prevents the depletion of the serotonin. Now, the most common one is antidepressants. Everybody knows about Prozac. Everybody's heard about Zoloft and Paxil. Those are very important and effective medications to be used in antidepression. Mood stabilizers, antipsychotics, which are for people with schizophrenia and psychosis. I won't name all the different medicines for treating these disorders, but there are medications for these disorders, and they're called antipsychotics. Benzodiazepines like Ativan and Xanax, they're sedatives. They're people with anxiety, people with, high-end emotions. You got to control these emotions, even if they're good emotions. That could be almost as, big a problem as, being depressed. There's a thing called manic depression, which you get the mania and you get the depression. You get the highs, you get the lows. You're fluctuating all over the place. So the benzos, as we call them for short, will help stabilize that. Then you get stimulants, like everybody's heard of Ritalin for ADHD. And this is usually in childhood disorders, where they'll treat this, or preteens, or even into teens, and it kind of balances out the disorder that you may be presenting with the attention deficit syndrome. So, that's a very important one to know. And this, again, will be, taken effect by either your primary physician or your pediatric psychiatrist. And the last one that I kind of want to touch on is something called lithium. It's kind of an old drug, but it's still around. It's usually used for manic depression and bipolar. So, there you go. That's a little basic overall view of mental health. I hope this has helped people educate themselves on mental health. We hear about it every day on the news: homelessness, mental health issues, crime, which is precipitated by a lot of mental health disorders. So, you can listen to this over and over. It's a good review. If you like it, that's great. You can share this with friends or family. People may need, some assistance. And this is kind of a nice little capsule of mental health disorders. So, it was good talking to you again. Thank you for your time. Remember, specifically in mental health issues, I am your friend, but not even close to being your doctor, because I'm not a psychiatrist. I did emergency medicine for 50 years, saw a lot of mental health problems. Always got the psychiatrist involved. Immediate medication is helpful, but you got to, have people that are going to take care of these people in the long run. So I'll be talking to you again soon. Thank you very much.